everyone, this is Dr. Sarosudhya from the platform of UKMLA with DSS, and let's just start our lecture for today. That is the structure and the approach that you need to take for the counseling sessions. Okay, and the counseling sessions are like really important because they are very frequently asked. Okay, and it is very much likely that you're going to see and you're going to encounter 2 to 3 different counseling sessions in the exam. Okay, and it may seem very easy that you don't have to go into a lot of detail of a lot of stuff, and it's just something that you need to talk about, and you just need to counsel, you just need to say a few lines, and you'll be good to go. But that is not really the case. Counseling sessions can get a bit difficult and it may become challenging, and there is a very strong possibility that you end up scoring very low in the counseling sessions. Okay, so it's really important that you understand the counseling sessions, you understand how to go about a particular counseling session, and you know what the approach you need to take when it comes to the counseling sessions. Okay, now before I begin teaching the counseling sessions, I would like to give a very strong credit to Dr. Lovaan. Dr. Lovaan is a very famous tutor who teaches PLAB 2, and in the counseling approach that he teaches, he also uses the 4 box approach, and the 4 box approach that I have shared over here, it's totally inspired by his structure. I've just tried to modify it a bit, and I've tried to make sure it's much more compact and it's much more summarized, and it's much more directed, and that is where the idea comes from. So the credit needs to be given where it's due. So you'll find this approach very similar to Lovan's approach. Okay, I'll just further break it down to you, and I'll further try to teach you that how are you going to apply this 4 box approach. Okay, there are a few things which are a bit different, not a lot, but a bit different from what Dr. Lovaan teaches. And the most important part, the most important take home point from this video that would be very unique would be the fact that I'll tell you how to apply this 4 box approach in different type of counseling sessions. Okay, because there are like more than 100 counseling sessions that are there, and 5 to 7 different categories of counseling sessions. Like for example, the test results, relative counseling, uh, patient demanding, patient refusing, lifestyle modification counseling. You need to explain a particular procedure. Okay, and then counseling the patient about learning disabilities. Okay, so like I'm going to tell you how you can apply this particular structure into each different type of categories, and I'll give you a few examples of a case from each of the category. Okay, just for your better understanding. All right, so yeah, let's just move ahead and let's just go forward. Okay, whenever you see a counseling session, and it's something that we have talked about in the previous lecture, in the lecture earlier on as well, that you should know how to identify a particular counseling session. Okay, and what are the things you need to look into, what are the things you need to see in the case notes to mark it as a counseling session. Okay, and once you're done with identifying it, and once you're really sure that okay, this is a counseling session, then automatically this approach should come to your mind. All right, so I'll just go through each and every box one by one. Okay, the box one. Okay, the box one is like really important. Okay, because it contains the questions that are very famously asked and very commonly asked, and a lot of PLAB 2 tutors they do share this idea that okay, you should always do something called the ICE. Okay, now what is the ICE? ICE is called the idea, concerns, and expectations. Okay, and a lot of PLAB 2 tutors would say that okay, do ICE in every session, do ICE in every session, but you must have noted that I haven't discussed and I haven't shared about the idea of ICE until right now, until the counseling session, because ICE is something that it's a very scripted thing. You're gonna see it in every notes. You're gonna see it being taught by every other tutor. Okay, but ICE is not always important. Okay, for the diagnostic stations, particularly ice is not very very important. Okay, just the concern aspect of it is something that it needs to be carried across. It needs to be asked throughout your lab too, the concern. Okay, and that is what I've like taught throughout my previous lectures as well, that every time you're doing a consultation it needs to be concern centric. Okay, so amongst the ice part, just make sure that you're touching about the concern part in every other aspect. But when it comes to the counseling session, ice becomes the most important thing. Okay, and you need to know that what ice is and how you're going to ask about it. Okay, so this is all going to be the box number one. Okay, so it is technically ICE, that means idea first, then concern, and then expectations. But I always want to be concern centric, and I always want to give the importance to the concerns first. Okay, so that is why I have placed the concern in the beginning. Okay, now suppose you are here in a counseling session, somebody wants to inquire about the procedure, or wants to get an investigation done, or they want to get discharged, they want to maybe quit smoking, they want some advice, they want to refuse the treatment, or they are here for the test results. Okay, it can be any concern that they might have. Okay, in the counseling session, and you cannot just define it. Okay, it's something so open, it's something so vast. Okay, they can present with any concern, okay, regarding the medical field. Okay, it can be the disease, it can be because of the symptom, it can be because of the investigation, it can be because of a procedure. Okay, so it's a very very vast thing. This concern is a very very vast thing. Okay, so you're going to ask the very very first question in your counseling session. No matter what symptom you see, no matter what situation you see, always start off with, can you please share the main concern as of today? Okay, can you please share the purpose of your visit today? What is your main concern? Okay, and once you ask that, they're going to give you a concern. Okay, like for example, they're going to say that, okay, I don't want to get a CT scan done. Okay, and then after you've got the concern, try to explore the concern. Okay, why are they particularly concerned about a particular thing? Okay, why do you want a particular thing? Why do you want to know about the procedure? Okay, or why do you want to get a particular investigation done? Why do you want to know about the discharge advices? Okay, you want to quit smoking, that is great. Can you please tell me why exactly do you want to quit smoking? Yeah, doctor, because my father, he was also a smoker, he got diagnosed with COPD, and now he is very very critical. Okay, so always make sure that you ask this follow up question. Okay, that is exploring the concern. Okay, and sometimes it may just be a single question. Sometimes it just may be a single liner question. Okay, in which you'll be exploring the concern. Sometimes the concern would be so big that there would be multiple questions. Okay, a bunch of questions that would be there to explore what is going on. Okay, to explore the concern of the patient. Okay, so like it is like really really important that you explore the concern. Do not just ask the concern and then move on, just because in your head it's there in your head that, okay, I need to complete the ice, or I need to complete all the data gathering, I need to speak for 8 continuous minutes. Let's just move on and let's forget about what the concern was. The purpose should be there to explore the concern. Okay, and then this would be what I call as the main concern of the uh, patient, or the main concern of the simulator. Okay, additional concern may be there. Okay, the patient may keep on dropping different concerns to you in the throughout the session, in the upcoming kind of conversations. Okay, so please make sure that you keep an eye for the additional concerns that may come up. All right, you're going to explain something. Okay, then another concern may come up. Okay, so you see it's all about concerns. What mnemonic I use is that C for counseling and C for concern. Okay, that is what I teach, that is what I always say. So the counseling session, always keep an eye for the concerns. Okay, then after you're done with the concerns, that is the main part of the counseling session, then you can touch upon the idea and expectations. Okay, Idea is basically assessing the knowledge. Okay, like you basically assess what the patient knows, or what the relative how much the relative has the idea about a particular condition, how much knowledge does a particular person have about a particular procedure, investigations, or guideline, or a policy, or how much the patient knows about the condition, about the disease. Okay, so it's basically assessing the knowledge. Okay, ask about the idea, that do you have any idea about the methods that we use to quit smoking? Do you have any idea about CT scan? Okay, do you have any idea what might be the results of your test? Okay, what have been told to you so far regarding your medical condition? Are you aware of the guidelines that we follow while offering a CT scan? Do you have any idea about how fatal diabetic ketoacidosis can be? Do you have any idea about the complications of this particular disease? Okay, so just try to explore the knowledge that the patient has or the relative have about a particular condition. Okay, so that is what assessing the idea is. All right, then expectations. Okay, what are your main expectations from today's consultation? Okay, my main expectation is that I want you to agree on the fact that I am not ready for a CT scan. I do not want to get a CT scan done. Or my expectation from today is that I need to get some good advices before I get discharged. My expectations from you today is that you give me those advices and you help me in cutting down my smoking habits. Or my expectations from today's consultation is that I want to fully understand about a particular procedure. Okay, so you need to ask that what is your main expectation of today, and why is this question like very very important? Because your entire consultation then would be very very much centric to what the patient wants. Okay, and this is what the art of counseling session is, and this is what needs to be done in the counseling sessions. Try to understand what the patient wants to say. Try to get into the patient's shoes and try to meet their expectations. All right, that is why the patient is here. That is the sole purpose of counseling session is. Okay, so always ask about the fact that okay, what is your main expectations as of today? Okay, so this is what the box one is. All right, now, once you're done with ice, now you know that the what the concern is, what the expectation is, and how much that the patient knows about his condition. Okay, so you just keep it there in the back of your mind, and now you move on to the next aspect of the data gathering. Okay, and this aspect can be a bit tricky because there is no fixed guideline. Okay, there is like no fixed way to go about it. All right, uh, Dr. Lovaan also teaches it in a lot of detail. Okay, but what I have done is that I've divided it into six different parts. Okay, and there are six different things apart from the eyes that you need to have in your mind and that you need to consider when you are doing the box number two, when you're doing the relevant data gathering. Okay, what you need to do is that number one, you need to keep an eye for exploring the situation. Okay, now what do I mean by exploring the situation? Is that you may want to explore any possible symptom. Okay, let's suppose the patient may be coming to you with back pain. Okay, and asking about the investigation of prostate specific antigen, and they want to get the prostate specific antigen done. So the patient has some back pain. Okay, you would have to explore the symptom very very briefly. Okay, and you see there is a lot of things that needs to be done. So always remember, just the ice and the concern needs to be in a lot of detail. Okay, box number two, data gathering. Okay, it needs to be very very focused. Okay, do not end up getting into the Odipara and the Socrates of it. Okay, just make sure that you ask focused questions. Okay, because your goal is not to reach to a particular diagnosis. The diagnosis is already there. Okay, you need to just address the concerns, and you need to gather that data which will be very very helpful in you in box number three, in which you will be explaining and addressing the concerns. Okay, so yeah, exploring the situation is important. Symptom. Okay, maybe you would want to explore an incident. Okay, that may have happened recently. Like for example, somebody wanting to get a CT scan of the head done. You gotta explore the incident that okay, how did the baby like fall down? What happened to the baby? Okay, you gotta explore the incident. Okay, then you may have to just briefly explore the disease. That okay, can you please tell me since how long have you been having the colorectal cancer? Okay, and since how long have you been having iron deficiency anemia? What have you done about it? How are you managing your day-to-day condition? Okay, and yeah, so basically the situation, exploring the condition, okay, that might be present at hand. Okay, and as I said that this is something you might find it a bit vague, because it's very vast and you cannot just have a a straightforward approach to it, but you just need to have in your mind that okay, you may be expected to explore a particular situation. Okay, that is the first thing that you may have to do in the data gathering. All right, then the second thing in box number two is the risk factors. Okay, like really important. You may talk about the risk factors of a particular disease. Okay, uh, or maybe, and you can see that I've put the risk in the bracket. Why? Because there may always not be a risk factor, but you may want to assess the risk associated with the symptom. Okay, like for example, somebody willing to be discharged. Okay, so you may want to just assess the risks that are associated and that risk that may come up if you discharge this patient home. Okay, so it's not always the risk factors, but basically the risk that you want to assess. Okay, and it can be uh, about a particular disease. Okay, it can be about a particular situation or a particular incident. Okay, so the second thing that you need to do is assessing the risk. All right, then the third box, it's like really important, the complications and the red flags. All right, so the third set of questions that you would ask in box number two would be any red flags or any complication that is associated with the disease, with the investigation, or with the procedure, or with the situation that is there in the hand. Okay, so always keep an eye for the complications and red flags. Okay, that should what are those things that raises some bell in your head that okay, this might be a problem. This can lead to something serious. Okay, so this is the third thing that you need to keep in your mind. Okay, now the fourth thing is the psychosocial aspect. I have separated it from the meftosa and I've mentioned it separately because the counseling aspect, is completely like it's just incomplete without the psychosocial aspect. Okay, so do assess the support, do assess the present condition of the patient. Who do they live with? Do they have support available or not? Okay, because if you are counseling on something, okay, that means that the patient is coming to you and looking for some kind of support. Okay, there would be some topics, okay, in which the patient would be needing some support or the other. Okay, so always make sure that you touch upon the psychosocial aspects. Okay, just a couple of questions: who do you live with? How are things at home? How is your life going nowadays? Okay, do you have the friends and family members for your support available? Just a couple of questions to assess the psychosocial aspect. Okay, then meftosa, do not do the entire meftosa. Okay, just a few part of the meftosa may be relevant in this case. Okay, so not all of the aspects of meftosa needs to be touched. Okay, so just cover the thing that you may see that is relevant for the situation. Okay, and then in the very end you may want to offer some examination, like for example somebody coming to you demanding to get a CT scan done. Okay, you may just want to perform a neurological examination just to make sure that everything is all right with the head, everything is all right inside the head. Okay, so offer the examinations. Okay, relevant examinations are like really important. You know Whenever somebody comes with a situation and comes with a particular disease. Okay, so these are the six things that you need to consider in your box number two. Okay, like really important. Okay, So box 1 and box 2 is all about your data gathering. Okay, whatever you will score in your data gathering would be on the basis of box number 1 and on the basis of box number 2. Okay, so make sure that you have the idea of these 9 different things that are divided into 2 different boxes. Okay, ICE, that is idea, concerns, and expectations. And then in the data gathering, the 6 different things, that is exploring the situation, then exploring the risks or the risk factors, then exploring the red flags and complications, then assessing the psychosocial aspect, then whatever is relevant from the maftosa part, and then moving on to the relevant examinations that you may have to offer. Okay, so one more thing, the examination that you offer in the counseling session, okay, it's unlikely to be a combined session. Okay, so the examination that you offer over here would just be verbalizing the examinations. Okay, so the counseling session would not come as combined session. Okay, they're most likely to come as pure counseling session only. Okay, so yeah, you need to keep that in mind. So now once you're done with the box number 1 and 2, okay, then comes the management part. Okay, on the basis of which you would be scored on your management. Okay, so the box number 3 is basically explanation and addressing of concerns. Okay, and what I mean by addressing of concern, the main concern of the consultation. Okay, the very main concern of the consultation. Okay, and explanation of the situation. Okay, like for example, you may have to explain a procedure. Okay, you may have to explain a particular test results, that okay, this is what the test result is, this is what it means, and this is why you have been having it. Then you may want to discuss the advantage and disadvantage of a procedure, habit, or investigation. Okay, it depends on the type of counseling session that is there in your hand. Okay, then you may have to suggest a few alternatives, like for example, somebody who is into the habit of smoking, you may want to suggest some alternatives such as nicotine gums and some medications. Okay, then you may have to give some advices like medical advices, non-medical advices, lifestyle modifications, and then maybe compliance to a particular disease. Okay, so box number 3 is basically just your explanation. That is the main part of your counseling. Okay, that is one you would speak and the patient would listen. Okay, over here the patient was speaking. The patient was giving you the concern, his idea, talking about the situation, telling you about the risk factors after you asking it. But in this particular layer, the patient would just listen to you. Okay, and this is a very important layer. Okay, your entire management completely solely depends on how well you manage this box number 3, how well you explain a particular thing, how well are you able to address the concern that is there in the hand, how well you are able to convince the patient to get a particular investigation, how well you are able to convince the patient to not get a particular investigation, how much in detail are you able to explain a test result, how much in detail are you able to explain the reasons for getting an abnormal test result, how much in detail and how well are you able to give him the discharge advices. Okay, and if somebody is not agreeing to a particular thing, how well are you able to suggest alternatives? Are you having a close-minded approach or are you having an open-minded approach? Okay, if not this, then this. Okay, so this is the really important box. Okay, your main explanation and addressing of the main concern would be this. Okay, so that is box number 3. um, it can be anything as I mentioned. Okay, so keep that in mind. Now the box number 4 or the last box. Okay, uh, you gotta make the referrals or do the medical management if needed. Okay, I've written it down, if needed. Why have I written it if needed? Because there is a possibility that there is no need for any medical intervention. Okay, and there are also further no concerns available, so your entire session may just end at box number 3. Okay, but if it is needed, then you would have to do the management. Okay, that includes a referral to a specialist, involvement of seniors, doing symptomatic management of a particular condition, then safety netting. Okay, and how to do it, I'm going to talk about it now in a much more detail. Okay. Yeah. So in the previous stations, we have been talking about the IRMAS protocol, that okay, we need to follow the IRMAS protocol for all diagnostic stations, for all history based stations. Okay. For the counseling stations, the approach that you need to follow is called the CARMS approach. Okay, CARMS, CARMS approach. Okay, now what is the CARMS approach? The C stands for concern. Okay, uh, you have already addressed this concern. Okay, in the box number 3. Okay, let's suppose that the patient starts giving you further concerns. Okay, if they start dropping you more concerns, okay, that you haven't explored in box number 3, and or after you are done with the explanation, then you can address these concerns in box number 4. Okay, so after the main concern is addressed, okay, in the box number 3, and if there are any additional concerns that are coming, you can address that them in box number 4 as well. Okay, all right. Then A stands for the advices. Advices can be anything. It can be lifestyle modification advices, diet, exercise, smoking, alcohol. It can be work related advices. It can be driving related advices. Okay, and the reason why the advices are like coming before the medical management and the referral, because this is a counseling session. Okay, and in the counseling session, what the examiner is looking into is how well you are able to give the advices, how well you are able to uh, counsel the patients. Okay, so it is like really important. Then comes the referral and admission. Okay, and it's something that is completely optional. Okay, it depends on case to case. Okay, only offer admission if there are any red flags present. Okay, and the referral can be made if there is a need, like let's suppose if the patient is having some psychiatric issues or something or the other going on with his personal life. Okay, then you may want to refer the patient to psychosocial therapy or CBT. Okay, so the referral part is there if it is needed. Okay, then in the medical management, all right, the M part. Okay, you need to make sure that you offer relevant investigations. Okay, investigation is not considered as a separate thing in the counseling stations. Okay, because the counseling station mainly focus on the advices and the concerns. Okay, so we have included the I part of the AirMass protocol in the medical management only. Okay, so relevant investigations if needed, like for example, somebody was refusing to get a CT scan done. All right, so you may want to offer them a CT scan. Okay, that is what your relevant investigation can be. Okay, in the medical management. Okay, and let's just stick to the CT scan person. Somebody coming to you with a head injury. Okay, you may want to after you've done counseling him, after you've done convincing that particular patient to get a CT scan done. Okay, then you may want to give painkillers, oxygen support, IV fluids, NG tube, antidepressants, steroids, insulin, levothyroxine. Okay, all of those things that are in your control. That is the FI2 level management. I call it the FI uh, 2 level management. Okay, just briefly do that. And why am I just asking you to stick to FI2 level management? Because this is a counseling session. This is not a diagnostic session in which you have to get into the complete management of it. Okay, just FI2 level management and just the relevant investigation only if they are needed. Okay, then safety netting. Okay, safety netting on red flags, like for example, bleeding, MI, any pain, severe headache, shortness of breath, or suicide. Okay, uh, just basic safety netting. Okay, to follow the CARMS protocol. Okay, and this is what would mainly make up the box number 4 of your consultation. Okay, and there is a slight overlap in the concern part. Okay, in which some of it would be addressed in box number 3 as well. Okay, so you need to have that this particular thing in your mind. All right. So yeah, this is what the four box approach is. Okay, and I'll mention it again. It is inspired by one of my tutors as well, Dr. Lovaan. I just modified it a bit and explained it to you in a much more detail. Okay, but it is completely inspired by Dr. Lovan's approach, and it is very similar to that. So credit to him where it's due. Okay, but this CARMS approach, okay, this is something that is solely made by me, and you need to follow it, and this is how your box 4 would even become much more, structured, and the chances of you forgetting things, okay. A lot of people come to me and say that, Dr. Sarosh, we forgot what to do in box number 4. I missed on the investigation, I missed out on the advices, I completely forgot to address other concerns. So if you know that in the counseling session you need to take the CARMS calms approach, okay, then automatically just this mnemonic will help you get through the station, okay. So keep this thing in mind. All right. One thing before I move on to the next lecture and discuss different type of counseling cases, and I'll tell you how to apply the four boxes. I'll just share one piece of information you need to know about this cancer screening guidelines in the UK. Prostate specific antigen, it needs to be offered to every male who is age more than 50. Okay, if somebody comes to you demanding to get a PSA done, it can be offered to someone who is of age more than 50. But let's suppose a 25-year-old is coming to you and they're asking you to get a PSA done. Okay, you're not going to offer or agree to it because he's not at a risk factor. Okay, and then colonoscopy, again, a patient would be asking about colonoscopy. Okay, and these are the procedures about mammogram, colposcopy, and endoscopy as well. Okay, so you are going to encounter these cases in either the explanation counseling or the demanding counseling. Okay, so you should be aware of the guideline so that you know that, okay, when to offer it, and which demands you should agree, and which refusals you should actually invest your time into uh, get these procedures done. Okay, so the colonoscopy is done every 2 years for patients age 61 to 74. Okay, really important, you need to be aware of it. Mammogram is offered for every woman every 3 years of age more than 35. Okay, somebody is they are aging more than 35, mammogram needs to be done every 3 years. Okay, this is the screening protocol. Then colposcopy every 3 years for women of age 25 till the age of 64. Okay, are you going to get some concerns? So the colposcopy case, a lesbian would come to you and she would be saying that, why was a colposcopy letter given to me? I want to know about it. I shouldn't be getting it. Okay, and then you would have to explain that, okay, since you're more than 25, and since you are a biological female, there is a risk of cervical cancer, and that is why it's a part of our national screening program. And we offer colposcopy to every woman 25 to 64 years of age to get it done every 3 years, and blah blah blah. Okay, so yeah, you need to be aware of it. Then endoscopy is offered every 3 years for Barrett esophagus. Okay, somebody who has Barrett esophagus, you need to offer them endoscopy every 3 years. Okay, so this is the cancer screening protocol that you need to remember. That what are the guidelines that are followed in the NHS and what are the guidelines that are followed in the UK, because you would have to use these piece of information to understand and to offer a particular procedure, or it will help you in dealing with the patients who are making demands and patients who are refusing a particular treatment. Okay, so that's pretty much it from my side for the counseling approach. Okay, we are going to discuss like different categories like test results, relative counseling, then we're going to discuss refusal, then we are going to discuss the demanding patients as well, then lifestyle modification, discharge counseling, and then the explanation counseling, and also in the end we are going to discuss how to deal with the learning disability patient. Okay, so it's going to be a huge lecture, but I'll split it into multiple small lectures. So that's pretty much it for this lecture. Okay, See you in the next class where we'll discuss about the test results counts.